a lesion, and I know you're implying it for our audience, lesion means the cancer itself. We call it tumor, we call it node, we call it nodule, we call it lesion. Really, it's kind of like a little bit of misnomer for different things, but we're implying that some kind of like body of cancer in the liver, and that we're implying as lesion. With this said, let's say we have one lesion which is small in size here, Amit. What about ablation?
Yeah, so ablation is another very good therapy that one can, once again, offer good local tumor control and offer a cure for the initial cancer. So ablation involves putting a catheter through the side, almost similar to a biopsy, except the catheter has prongs at the end that can then surround this cancer nodule and use different techniques, whether that's heat, whether that's freezing it, or it's using microwaves to thereby, quote unquote, ablate the tumor, cause it to liquefy and, essentially remove the tumor from the liver, leaving a cavity behind. Now, this is a procedure where one is able to do this very well for small tumors. You have the best responses for lesions less than 2 centimeters. You have good responses up to 3 centimeters. You start to have decreased efficacy once you exceed that 3 centimeter mark, although you can use overlapping zones sometimes for larger tumors up to 5 centimeters and still have good control. Ablation is a good therapy, particularly if you're not amenable to surgical resection and you're found at an early stage. The downside of local ablation is that this needs to be in a location that is amenable to being percutaneously approached. So sometimes if lesions are high in the dome, or if they're close to other structures in the liver, it can be difficult to access them. And the second is there is a high risk of recurrence. And so the recurrence risks can happen either locally or elsewhere in the liver. And so the recurrence is typically somewhere around 70%, within the 5 years. And so we're looking for strategies to reduce that risk of recurrence over time after local ablation as well.